Hi students, hope you're all doing good. In this video, we are going to discuss about lactation and breastfeeding. So before starting with the actual topic, I want to recall about the anatomy of the breast. See, this is the cross section of the breast, right? So you are able to see that the breast consists of lobes, okay? So usually there are about 15 to 20 lobes in a breast, and inside the lobe, you have something called as lobules, right? So what happens is that in this each lobule, you will be having an alveoli, okay. Then finally what happens, from these alveoli you will be getting the alveolar ducts which will be opening together at the nipple, okay. So it is the alveolar epithelial cells that are going to secrete the milk, understood. So what I told you now, breast consists of 15 to 20 lobes, and within this many lobules are present, and these lobules are separated by various amount of fat, and each lobule contains alveoli from which arises the alveolar ducts that will be opening up in the nipple, and the alveoli is lined by secretory epithelium. This secretory epithelium is going to produce and secrete milk. Can you understand? Yes. Let's talk about physiology also. So when we speak about physiology of lactation, it can be divided into 4 main phases, okay. Number 1 is mammogenesis, where there is growth and development of the breast during pregnancy, right. Second one is lactogenesis. So lactogenesis is nothing but initiation of milk production in the alveoli. Third step is galactokinesis. So after production it has to be ejected out, right. So that is nothing but the milk ejection. Fourth step is galactopoiesis, which is nothing but maintenance of the milk secretion. Clear? Yes. Now we will discuss one by one in detail. So what I told you about the first step, it is mammogenesis. So what is going to happen in mammogenesis is the size and weight of the breast increases, okay, during pregnancy. And then why this happens means, this happens mainly due to development and proliferation of the alveolar secretory epithelium, right. And mainly this happens under the role of the hormone progesterone. Clear? Next step is, yes, lactogenesis. In lactogenesis, there is mammary gland differentiation. Usually it happens in pregnancy itself. Colostrum secretion usually begins in the mid-second or third trimester itself during pregnancy. Remember, this colostrum is rich in minerals, proteins as well as immunoglobulins. After this, the regular milk secretion starts 2 to 3 days postpartum, okay. So what oxytocin causes means, oxytocin contracts the myoepithelial cells of the ducts of the breast. Clear? That will be helping in bringing about the milk out. So this is about the steps I have told you. First, there is suckling of the areola. By that, there is nerve ending stimulation, especially the T4, T5 and T6 nerves that is supplying the breast. Then the stimulated nerve signal will be traveling through the spinal cord, will be reaching the pituitary gland, where the oxytocin is stored and that will be released in a pulsatile fashion, and the myoepithelial cells of the ducts will be contracting and there will be release of the milk, okay. And final phase is galactopoiesis. So galactopoiesis means it is maintenance of milk secretion. Okay, there is maintenance of milk secretion. Especially this happens from 4 to 6 days postpartum till weaning. This happens due to suckling as well as the hormone oxytocin and prolactin, but more importance is due to prolactin here. Clear? Now, I will let you know the difference between the hormone oxytocin and prolactin once again to make it even more clear. So, we have oxytocin, we have prolactin. We know oxytocin is synthesized in the hypothalamus and it is stored in the posterior pituitary. Whereas prolactin is a polypeptide. This is secreted from the anterior pituitary, and remember prolactin is under inhibitory control of dopamine always. Action starts with the cry of the baby. Oxytocin is an important hormone in milk ejection, whereas prolactin is an important hormone in galactopoiesis, that is maintenance of milk secretion. Clear? Yes. Now, we will see the changes that will be happening after birth. So, there will be involution usually after 40 days of childbirth, mainly due to increase in inhibitory signals and stoppage of the activating signals. Okay. Now, we will see the milk secretion. Okay, so what is colostrum? What is the actual milk? So, when we talk about colostrum, it is usually a thin fluid that contains fat globules, acinar cells and colostrum corpuscles. Colostrum corpuscles contains polymorphonuclear leukocytes. Then they are also high in protein and immunoglobulins, especially the immunoglobulins G, A and M. Clear? Then we will see about human milk. Human milk will be secreted in phases, okay, while the baby starts feeding. So, the first coming milk is known as foremilk, that is the first milk ingested by the infant, right, and this has a low fat content only. If you take the hind milk, it consists of increased amount of fat when compared to the foremilk. Also, you will have various enzymes for digestion of proteins, carbohydrates, fats, etc. And then you have some of the minerals also like zinc, magnesium, selenium. Essential fatty acids like arachidonic acid and DHA are also present in the milk. Clear? Right. Now, what are the advantages of giving breast milk? See, breast milk is an important way in which the passive immunity is acquired from the mother to the fetus. Okay, so there is passage of passive immunity from the mother to the fetus, and there is reduced risk of gastrointestinal infections like E. coli infection, rotavirus infection or allergies. Sometimes even dermatitis and respiratory infections. There is also reduced risk of dermatitis and other respiratory infections. It protects against necrotizing enterocolitis, and in the adult age group, there is reduction of type 1 diabetes mellitus, obesity, cardiovascular disorders and asthma as well as allergies as well. Clear? And more than that, while breastfeeding there is skin to skin contact which will be giving neurohumoral benefits to the baby. It will help in acquiring a better IQ, mental as well as psychological development in the infant. Okay. Not only for the infant, but there are some advantages to the mother also. For the mother, it helps in uterine involution. It acts as a natural contraceptive. Serious risks are reduced in the mother. Then there is decreased risk of breast cancer, endometrial cancer as well as ovarian cancers. Clear? Now we will see with how much adequacy the infant should be breastfed. So adequacy of breastfeeding. See, in 24 hours there should be ideally 8 to 12 breastfeeds that should be given around 10 to 15 minutes. Okay, each feed should be lasting for 10 to 15 minutes. The adequacy can be checked by the voiding of the fetus. There should be voiding around 4 to 6 times, especially this should be started around day 3 to 4, and after day 5 it should increase to 6 to 8 times, because the first 2 days the baby will be feeding on the colostrum. Okay, and then stools should be around 3 to 4 stools per day after day 4. Clear? So if this is happening, then we can say yes, the baby is adequately breastfed. Now we'll have some contraindications of breastfeeding also. Contraindications of breastfeeding include when there is maternal HIV with high viral load, or mother who are on illicit drugs, or mothers having active tuberculosis, and who are undergoing treatment for breast carcinoma, and when there is some psychiatrical complications like puerperal psychosis. Okay. So in all these cases, and also in case of IUD, we have to suppress the lactation. So these are the indications of suppression of lactation also. Clear? Now what is the drug we give for suppressing the lactation? We usually give tablet bromocriptine at a dose of 2.5 milligram OD or BD for 1 week. Yes, otherwise we can even prefer to give tablet cabergoline at a dose of 1 milligram single dose, or you can split it and give us 0.5 milligram 2 doses. Clear? And also we can try pyridoxine 40 milligram BD for 1 week. Clear? So among this, the most preferred drugs are bromocriptine and cabergoline. Pyridoxine we are not using it regularly, right? Okay. Suppose there is inadequate breast secretion, then you can use some galactogogues, okay, to facilitate the milk production. Here the drugs which are acting as dopamine receptor antagonists can be used, and these drugs include metoclopramide and domperidone. Okay. So this will be needed especially in case of preterm birth. Yes? Right. Now, we'll see the technique of breastfeeding. See, whenever the mother is breastfeeding, the mother should be in a comfortable position. Her shoulders and arms should be relaxed, and for that you may use even pillows or cushions. Baby should be in a straight line without neck twisting, and sometimes slight extension of the head may be needed to latch on the nipple. Remember, you can bring the fetus towards the breast, but mother should not lean over the infant, right? And then baby should be kept at the level, like the baby's mouth will be at the level of the mother's nipple. Now, when the baby is kept at this position, what happens means, as soon as the nipple touches the baby's mouth, the baby is going to open its both upper and lower lips. The nipple will be sucked inside the mouth, and the baby will be using its tongue to initiate the suckling reflex, and it will be drawing the milk inside. Clear? So, when the nipple touches lip of the baby, mouth opens widely. That will be leading to drawing nipple inside. That will be initiating the suckling reflex. Clear? Now, how can we know whether the latching is correct or not? See, when the latching is correct, the nipple as well as the areola will be taken up to the junction of infant's hard and soft palate. Clear? So, now what happens? Infant's tongue is going to compress the areola. So, that will be causing the milk to travel from the lactiferous ducts, into the infant's mouth. Clear? Now, we will see some of the problems that are faced during breastfeeding. Usually, the problems faced by the mother include retracted nipple. See, this should be ideally diagnosed in the antenatal period itself. And you can use a syringe pulling technique or it can be simply pulled out by fingers. Next thing is, because of the frequent breastfeeding, there can be cracked nipple. So, for this, nipple should be cleaned before and after the breastfeeding. Proper latching should be advised. Sometimes you can give emollients also for the comfort. Another problem you can expect is engorgement of the breast. So, this happens when there is excess milk secretion. You should advise them frequent breastfeeding or expression of milk either manually or by using a breast pump. For pain relief, you can give them analgesics or antipyretics if there is a fever. Clear? Sometimes this can lead to mastitis also. So, usually mastitis spreads through the organisms that are present in the infant's mouth. You will have fever, redness of the breast as well as tenderness of the breast. Then we will see what is breast abscess. Here the breast is red, tender and indurated. There is localized collection of pus present in the breast abscess. You can use USG for confirmation of pus collection, and it is treated with antibiotics or drainage followed by a incision. That is, incision and drainage can be performed. Clear? So, with this we are finishing the discussion on lactation and breastfeeding. I hope this helped you as well. So, until we meet in the next video, take care, happy learning and bye-bye.